radio, we have reached the muscles of the lower extremity. Hip flexors. The hip flexors will include the psoas muscles and another muscle which is known as iliacus, which sits within the iliac fossa, and they can be combined and identified as iliopsoas. So I'm fine with you knowing either the psoas muscles and iliacus or iliopsoas. The P is silent. If you take a look at the image on the far right of this picture, you will also see the green muscle that attaches from the ilium down along the femur. That is indicative of rectus femoris. So the quadriceps muscle will also flex the femoroacetabular joint. So iliacus, psoas, or iliopsoas, and rectus femoris of the quadriceps group are all considered hip flexors. If you take a look at the image on the far right, you're going to see a thin strap-like muscle, which is known as sartorius, and that also will provide hip flexion. The other hip flexors are going to include pectineus, which is a small muscle along the medial aspect of the femur that is going to attach to the pubic bone. Tensor fascia lata, which we will talk about in the not so distant future during this video. The hip extensors will have the opposite action of the hip flexors, of course. They will include gluteus maximus. They will also include the hamstrings. And the three muscles of the hamstrings that you need to know are biceps femoris, semitendinosus, and semimembranosus. Biceps femoris is going to insert laterally on the tibia, and semitendinosus and semimembranosus will insert medially. We have a couple of actions that we need to talk about when it comes to the leg or the hip, because that's where this action will actually occur. Medial rotation, also known as internal rotation, and lateral rotation, also known as external rotation. The lateral rotators of the thigh will be gluteus minimus and another muscle that you need to know, which is piriformis. So the piriformis muscle is clinically significant, and as soon as you hear those words, your antenna need to go up, because the piriformis muscle can entrap the sciatic nerve and therefore trigger pain along the distribution of the sciatic nerve, which supplies the posterior aspect of your lower extremity. Medial rotators will be iliopsoas. It is a pretty cool muscle. Then we have the adductors. There are going to be a group of them. Adductor magnus. There's a longus. There's got to be a brevis, and sure enough, we have adductor brevis and adductor longus. And we also have a very thin, fine, in quotes, graceful muscle, hence the name gracilis. That is going to be another adductor of the thigh. These muscles tend to be quite pronounced in ice skaters. Abductors of the hip will be gluteus maximus, gluteus minimus, and gluteus medius, all three gluteals, as well as tensor fascia lata, which we also saw is a hip flexor. We already talked about the adductors. That's a little out of Whack. So let's move to the quadriceps muscles. There are 4 of them, hence the term quadriceps. You need to know the names of all of them. Rectus femoris, we've already discussed. Rectus femoris is going to be a hip flexor. It will also extend the knee, as will vastus lateralis, vastus medialis, and then we're going to have a muscle that is deep to rectus femoris, which is in the middle, hence the name vastus intermedius. They are called vastus. All of those, 3 of those muscles are called vastus because they are big. They are major muscles for walking and for posture. They will insert upon the patella via the quadriceps tendon. The patella itself will attach to the tibial tuberosity via the patellar tendon. And this is, I guess for the purposes of this course, that's a nicety. However, there is a quadriceps tendon and there is a patellar tendon. You'll remember that is the quadriceps that will attach through one or the other tendon, quadriceps or patella tendon, to the tibial tuberosity. And that is the landmark that is implicated in Osgood-Schlatters disease, which we talked about. That is when the tibial tuberosity is actually starts to lift off the tibia due to the stresses and strains of athletic children. And that happens because the tibial tuberosity is not fully fused to the tibia. Sartorius, we already mentioned. Sartorius is that thin strap-like muscle. If you know anything about Latin, it comes from the root of the word, which has to do with clothing or dressing. It is known as the tailor's muscle, hence the term sartorius. If you know what sartorial means, someone in their sartorial splendor means they're dressed really well. It is considered the tailor's muscle because back in the day, tailors used to sit with their legs crossed in order to keep their material in their lap so it didn't drag on the dirty floor, and the floors were literally dirt most of the time. So sartorius is the muscle that allows you to cross your legs. We've already mentioned tensor fascia lata, and we definitely need to talk about the iliotibial band. You might hear it called iliotibial tract. Tensor fascia lata basically tells you what the muscle is doing. It is tensing a lot of fascia. And the fascia that it's helping keep tense is the iliotibial band. So the iliotibial band is going to be very important because it is a major lateral stabilizer of the knee. If you've seen the movie Forrest Gump, when Forrest and Elvis are dancing and their legs are going out like chickens, every time I see that scene, I think iliotibial band. Is the iliotibial band that keeps our knees tracking anteriorly and not swinging out to the sides. That would be a pathology. And tensor fascia lata will insert on that and help keep that taut.